Thank you, Christy. Sorry, I had some trouble with the mute there. Good afternoon, everyone. We are continuing to roll out our state's COVID-19 vaccination plan successfully and with great speed. As of today, more than 2.2 million doses of life-saving COVID-19 vaccines have been administered in South Carolina. This is truly remarkable, especially when you consider that the very first COVID-19 vaccine only became available about 3.5 months ago. Nearly 110 million Americans have received their shots. We, like public health officials across the country, continue to stress how crucial it is for everyone to get vaccinated who is eligible. We've all sacrificed so much over the past year, and we can see the end now. We can put an end to COVID-19 by all getting vaccinated. More than 8,000 South Carolinians have been confirmed to lose their lives to COVID-19. Think about what they and their family members would have given to have had a vaccine available before they lost someone that they loved. And now it's here. Vaccine is here, and it's incumbent upon each of us to step up to the plate, roll up our sleeves, and fight this virus. We know that people are on the fence about getting the vaccine. This is especially true with some of the minority groups and some of the young adults. And we've discussed for months. We fully understand why our Black and African American communities are hesitant to get their shot. We're told that historical events in our country are the foundation of why these communities distrust these current vaccines. These are legitimate concerns. However, as Dr. Bell and so many of our state leaders continue to attest, these COVID-19 vaccines are safe and have been both rigorously and ethically tested by scientists, doctors, and medical researchers. These vaccines not only are safe, but they can save your life. Millions and millions of people, as I mentioned a moment ago, have received their vaccines, and they're now protected against this deadly disease. We're also connecting with community partners, schools, and universities to help our young adult population understand why it's so important for them to get vaccinated as well. The data has continued to show that young people are less likely to experience the severe illness if they were to become infected with COVID-19. And that is true. But young people spread the virus to others, to those who can experience the severe illness or need hospitalization due to the virus. And we have to take care of each other until enough of the population has been vaccinated. Some people may have a sore arm or some aches and pains after getting their shot. This means that the vaccine is working in your body. But we don't want those side effects to be used as the reason for people to not get their vaccine. Feeling unwell for a day or two is a small cost when compared to what the COVID-19 vaccines can give you, that protection against a deadly virus and bringing an end to this pandemic. If you felt sore or achy after your first shot of Moderna or Pfizer, please don't put off getting your second shot. The majority of the post-shot symptoms go away after a day or two and can be lessened with over-the-counter medicines. So please make sure that you get your second shot and in a timely manner when indicated. That's the only way to ensure that you are protected as much as possible. We hear that a lot of people are waiting for the one-dose Janssen vaccine, but we can't advise that that's a good idea because the Janssen vaccine remains very limited. We received only 7,000 doses of Janssen vaccine this week. To compare, we're receiving more than 40,000 doses of Moderna and Pfizer each week. The best shot for you is to get the shot that you can get in your arm the soonest. Please don't wait. Make your appointment today for whichever vaccine that you can get first, and don't put off that second shot when it's time. It's going to take all of us together to finally end COVID-19, and I know that we can do it. We just have to all make sure that we get our shots and we get them in as soon as possible and in a timely manner for those second shots. Thank you.
Thank you, Dr. Traxler, for that wonderful update. At this time, we're going to move into our questions that were submitted ahead of time. The first one is the recent statewide drop in confirmed COVID-19 deaths correlated with the vaccine uptake among residents at long-term care facilities?
So I want to to note that correlation doesn't always imply causation. Seeing our deaths decrease is a wonderful thing. And our initial vaccine rollout was directed to protect some of our most vulnerable populations in the state. Throughout this pandemic, we've unfortunately seen the deaths being predominantly from the older population. And while we continue to see that be the case, these numbers of deaths have dropped significantly. From a case perspective, we're not seeing the huge clusters of cases that we potentially were once seeing. Sometimes we would see multiple clusters in long-term care facilities each day, and we're not seeing those currently. That's a huge message, I think, that demonstrates the effectiveness of the vaccine. But I do want to stress that it is difficult to say with certainty that is the cause, that the vaccine is the cause of these decreased deaths. But certainly, we are seeing it in a manner that would make sense in terms of the time frame.
So are healthcare facilities in South Carolina using a steroid nasal spray to treat patients who have lost their taste and smell from COVID-19?
I'm sorry, I don't have that information. I would have to recommend asking the healthcare facilities directly if they're using anything such as this or what treatments they are using.
And one common argument against getting the vaccine is, why would I get a vaccine with 95% efficacy for a virus that has 99% survivability? What is your response to that? And is it even fair to compare vaccine efficacy to survivability of COVID-19?
Sure. So while I'd say the survivability of COVID-19 infection is very high, it's still not 100%, even among the young, healthy individuals. Furthermore, even if an infected person does survive the disease, they still may feel quite poorly, not only short term, but also long term. We're continuing to learn more about this disease and how it affects the body, including and especially long term. As you're all aware, some individuals have significant lingering effects that greatly impact their quality of life. So I do want to remind everyone that the mortality or death is not the only negative impact of being infected with COVID-19. And I would say it is difficult to compare directly a percentage of survivability to efficacy, that those two percentages might not be a fair direct comparison.
And now that every adult is eligible, how do we get the vaccine to people who won't take the time to sign up for an appointment?
So Dhec is continuing to work with our partners to make sure that the vaccines are as widely and easily accessible as possible for all eligible South Carolinians, which includes now all persons age 16 years and older. As the vaccine supply increases, we and our partners will continue to evaluate methods to improve access to the vaccinations. That includes potentially having larger events that don't require an appointment, or even smaller ones that don't require an appointment to be scheduled in advance, as well as clinics with early morning and evening hours, some of the more non-traditional hours. We're continuing to work with those community partners and those local trusted partners to discuss at the very local and personal level about why vaccines are so important and help get everyone encouraged to get a vaccine.
And can we get more details on how this new funding, that $47 million from the CDC, will be used in South Carolina?
Sure. As with most states, this federal funding is going to provide additional support for these established community level outreach activities and is going to target vaccination among the minority populations, the underserved neighborhoods, and the young adults who might be less inclined to receive their vaccines, as we've been talking about. So the use of the federal funding to further enhance vaccination efforts in South Carolina will certainly follow all of the federal stipulations that comes with it.
And Dr. Traxler, this is sort of a specific question that we may or may not be able to answer right now, but there is an online claim that the COVID-19 vaccines have caused 2,000 deaths in the United States so far. And people are citing data from the CDC VAERS website as proof. Have there been any confirmed deaths linked to the approved vaccines? And what are the pitfalls of using VAERS to link the vaccines to deaths? Do you have any information now on that?
So I'll have to get back to the person that asked, that question. We'll have to get back with you to look. I do know that certainly anytime there is a report of a death that, based on the relationship with time from a vaccine, there's concern the CDC thoroughly investigates it. And so I'll have to look into the details of this question and this online report and the VAERS data.
Okay. Thank you. Are there any parts of the state that have seen a significant drop in vaccine demand?
So available appointments for the vaccine appear to be relatively even across the state. We haven't seen any clear indications of a major drop in demand in a particular area. However, I will say that having any appointments available at this point is concerning. And I do want to remind all South Carolinians of the importance of receiving anyone, whichever is first available to you, of the 3 very safe and effective vaccines that are now available to all persons 16 and older in our state.
And can you confirm the presence of another vaccine hesitancy pulse survey conducted by Dhec? And when might we find out the results to this?
So sure, we are asking for the public's help. We certainly want the public's health as well to be good, but we want the public's help in completing this community pulse survey on the COVID-19 vaccinations. We have extended the deadline to this Friday, April 9th, and I believe it is available on our website. And certainly in a couple of weeks, we can share those results when they're available.
Is the Homebound Seniors pilot program in Hampton and Jasper counties finished? And if so, or even if not,
Oops. You there, Christy? Sorry. Can you hear me?
Yeah, I can hear you, Dr. Traxler. Can you hear me now?
I can. Sorry, you broke up on me there. You're asking about the Homebound program, though?
Yeah, so the question is the Homebound Seniors pilot program in Hampton and Jasper counties finished? And how many people were vaccinated during the pilot?
Sure. So that pilot, my understanding is that it is finished and that for the most part, and that I believe the data is the same as what we may have discussed, I think, on Friday, that about at that point, 70 people had already been vaccinated. There were another 16 who were on the list and were getting ready to be vaccinated. We can get you an update on how many of those 16 now since Friday have been vaccinated that were on the list. And that may seem low, but again, I want to remind folks that one thing that was learned during this pilot is that a number of these individuals who were eligible, those 2 counties had already successfully received their shot. About 70% of those who were eligible, who were on the list, had already been vaccinated. So that is the status of those, and we have just finalized a solicitation for providers to bid for other counties for homebound vaccination, and certainly the implementation of the program is going to depend on providers' willingness to bid. So hopefully we'll see that going forward.
Okay. Is there any Dhec program for assisting long-term care facilities in getting residents or staff vaccinated now that the CDC partnership program has finished?
Sure. So we're continuing to work with our state's long-term care facilities to connect them to those local providers and local vaccination opportunities as new residents or staff should need their shots as they enter a facility. So we're continuing to work with all of them as needed.
Is Dhec familiar with the Dr. B website that connects residents to leftover vaccine, And if so, what are your thoughts on it?
Yes, I've seen the website we have. However, the current callback lists that are being maintained by the individual vaccine providers in the state, including Dhec regions and sites, have been working very well with very little wastage of vaccine or complaints that we've heard from the public. So we recommend that process continue to be utilized.
Thank you, Dr. Traxler. Is DHEC doing anything to ensure more people are getting vaccinated in these communities where supply is fine, but demand is low?
So we continue to work with those local partners, as I mentioned earlier, in these communities throughout the state, including businesses and faith-based organizations, to continue to promote the importance of vaccines and spread accurate information to everyone. Reports are showing that as more people receive their shots, undecided people are becoming more willing to get their shots, and which is certainly a great thing. And we're doing ongoing outreach with DHEC, again with these local trusted community partners. Testimonials are another great way that these local partners and local trusted folks are helping us. And we'll continue to do these efforts.
Is this normal virus, or is
Christy,
the public to know? Can you hear me?
Yeah, sorry, I don't know if it's you or me.
Okay, let me repeat. How do you see the trending plateau in the virus today? Is this normal behavior for the virus, or is this a warning sign? What would you like the public to know? And is there a fourth surge ahead?
So it's good that the case counts have decreased to the levels that they currently are, but the trend needs to not plateau, but rather continue to go downward. The public needs to understand that while cases are certainly improved from where they were in the winter, the virus is still widespread in the state, in our communities. And it's our actions now that determine whether we continue to drive these numbers down or see another increase. I cannot stress enough the importance of all eligible people getting vaccinated as soon as possible, and people completing their vaccination series if they receive the Pfizer or Moderna vaccine, and doing so in a timely manner. It really is important that everyone who's able to get vaccinated get the first vaccine that's available to you as soon as possible.
All South Carolinians 16 and older are eligible to receive the vaccine. What percentage or how many younger people are getting the vaccine compared to older individuals? And then secondly, Dr. Traxler, do you anticipate a slowdown in vaccine demand now that those who needed or wanted the vaccine most have received it?
So our demographics, including age groups for people who have received vaccines and are receiving their vaccines, are available on our website, on our vaccine dashboard, which can show you some of those percentages. Our dashboard shows that as of today, about 31,000 women and 19,000 men who are age 16 to 20, the youngest age group eligible, have received at least their first shot so far. And again, I really want to encourage everyone who is 16 or over to get vaccinated and get the first vaccine available to you, and certainly complete your series if it's a 2-shot series.
And Dr. Traxler, that dovetails nicely into the next question, which is how important is it now for adults to get vaccinated?
For younger individuals? So we know that the 21 to 30-year-olds are our highest age group for cases. They account for about 17% of the cases we've had so far in the state. And among these age groups, it's these young adults, it's that group with the highest percentage that are driving the most transmission. And we have seen some positive data, more recently that the vaccine is also protective against transmission of the virus. The data is primarily emerged with Pfizer, but they're continuing to study not only that, but all the vaccines. So we need this age group to get vaccinated to lower the spread of the disease in our communities. So it still is very important.
And many people are experiencing harsh side effects after receiving the vaccine. Specifically, I've heard many young people with healthier immune systems. Do you know if there's any validity to this claim?
So I haven't seen any medically backed information on this, so I don't think I can comment specifically, but I do say that, I want to remind folks that shot symptoms, that those aches and soreness I mentioned earlier in the remarks, that last a day or two, are a small price to pay for the protection against COVID-19 that the vaccines give you.
And according to a study from AARP, COVID-19 vaccine side effects are stronger in women. Why is it that women are seeing stronger side effects compared to men? Can you speak to this at all?
I don't know that specific AARP report, though I don't know if you have it, Christy. If you can, certainly please send it, and I'll also look for it. So I can't comment specifically on this, but again, anybody who's experiencing some of those symptoms from the shot, those aches or soreness, they only last a day or two, and are often improved by over-the-counter medications. And again, it's a small price to pay to prevent COVID-19.
With more of the nation being eligible to receive the vaccine on the 19th, how will this impact South Carolina receiving doses?
So we're going to have to wait and see, if so, how it may impact states' allocations. We do have appointments available in our state right now. So it's another reason I encourage people, everyone who's old enough to be vaccinated is eligible in South Carolina now. So I encourage you get your shots now, and don't keep waiting. Go ahead and get them now before that April 19th deadline or date.
And so we've got concerns from young women about the vaccine's impact on fertility. Is there any data that supports that young women should be concerned?
So I have also heard this, though I will say that I am not aware of any data, any scientific data that does say that it has a negative impact on women's fertility. So certainly, individuals should speak to their healthcare provider if they have specific concerns or questions. But I know that overall, I'm not aware of any data that shows it has a negative impact on fertility.
And are there enough folks vaccinated to say it's having an impact in the spread of the virus?
So certainly we've seen a decrease in the spread of the virus since that last peak in January, which has occurred whilst vaccination rates are increasing in that same time period. Again, it's difficult to be able to say with certainty that this correlation also, actually represents causation. We do know that the vaccination rates must continue to increase to stay ahead of the spread of the variants and to achieve herd immunity.
And does Dhec have any suggestions on what people should do with their vaccination card after they get fully vaccinated? For instance, should a copy be made and the original stored, or should the copy or original be laminated?
So as with any, personal health information, Dhec recommends storing vaccination cards in a safe, secure place. And if a person has the ability to do so, making a copy again to be kept in a secure location, and or laminating it could be further ways to protect it. But that primary, mechanism of protection is keeping the information in a safe and secure location.
With summer on our side, is this the time to really make the push to vaccinate so we head off a return to big numbers in the fall?
So we need to make the push to get as many people vaccinated as possible, as quickly as possible, not only prior to seeing that cooler weather and when we see more people spending more time indoors, but also to be ahead of the spread of the current variants and any potential future variants.
And is there any concern, is there any reason to believe COVID cases are higher than test results suggest in South Carolina?
I have not seen any recent statistics on this. We can check to see, certainly as testing has become more easily accessible and very widespread and available to throughout the state, then we would anticipate that more cases would have been identified through the testing than what we were seeing in the early days of the pandemic when testing was much more difficult to come by.
And does Dhec have an estimate of what proportion of COVID cases in South Carolina are variants, such as the variant that originally emerged in the United Kingdom?
Sure. So we have a website with a map online that tracks the known cases in South Carolina of the variants, including the United Kingdom, the South African variant. So you can find the current numbers about any of the variants located there.
Last submitted question. So at this time, I'm going to open it up for live questions from members of the media. And Alicia, you've had your hand up, I think, the entire media briefing. So you've got a question.
Thank you very much. Good afternoon. You mentioned earlier, Dr. Trexler, about a lot of folks waiting to get the one-dose Johnson & Johnson vaccine. What do you find to be the main reasons behind so many people wanting to wait for this particular dose or shot?
Can you all see me and hear me?
We can now. Thank you, Dr. Trexler.
Sorry, I think that the connection issues are on my end. I know we're in different Dhec buildings today, Christy. And as I was signing on, I heard a voice finishing asking, I think, a question, but I'm sorry, I didn't hear it. If you can repeat it.
Yes. Earlier you mentioned, Dr. Trexler, about how many people are waiting to get the Johnson & Johnson vaccine instead of getting whatever vaccine's available. What do you find to be the main reasons behind that?
So we are hearing those reports, that kind of those anecdotal reports. I don't know that I can speak, in terms of statistics for why that is the case, though some of the various reasons that I've heard, a lot of them center around only needing one shot instead of two, either because people aren't big fans of getting shots or because of the logistical then maybe they have logistical concerns with getting a second one if they get one of the other two. But I don't have statistics as to which is the predominant reason.
And Anne, you've got a question? Anne Maxwell, can you unmute, please, and ask your question? Vanessa, do you have a question for Dr. Trexler?
I do. Thank you for the opportunity. One thing that I am seeing online is folks who are, they're not hot on getting the vaccine, but circulating claims that, people who are getting the vaccine will be going out and donating blood and contaminating the blood supply. Is this a legitimate concern based on what you know about how long the vaccines even last in the human body? And is there anything else you could add to that?
Sure. So certainly there is the factor, as you mentioned, of the timing for when someone got the vaccine and when they went and gave blood, either regarding whether some of their antibody or protection levels had decreased because long enough had passed, or because maybe they went and gave blood very soon after vaccination and had not yet developed those antibodies. But regardless, I do want to remind everyone that donating blood, while life-saving and one donor can save multiple lives, it still is a very small amount of a person's blood. So that is why we can do it safely. And so any antibodies or protection that does go into the donated blood would be a very small amount compared to how much blood you have in your system.
And we're going to try to go back to Anne Maxwell again. Anne, can you try to unmute and ask your question for Dr. Trexler? you. Samantha, you've got a question?
Hey there, Dr. Traxler. Appreciate you being here. A couple of questions for you. First, about masks. Just being out and about and on the streets, you know, we have heard from people who both have been vaccinated and who have not been vaccinated, who are saying, hey, now that more people are getting vaccinated, you know, it's time to cut the mask ordinances, the local ones, and time to get back to normal. So can you just touch on why it's still important for people to be widely using those masks?
Certainly. So I, like everyone, am ready when it is safe to do so, to not be wearing a mask. But we still are seeing this virus spread, you know, to be widespread in our state and in our communities. And so vaccination rates, while they are increasing, I certainly hope they continue to increase. That is one way that we can help drive down virus that's out there circulating and being spread, but we are not to that point yet where it is low, very low or minimal risk to people when they're out and about in the community. So I still continue to encourage folks, unless you are in one of those settings that the CDC describes, such as with one other household, you know, everyone's fully vaccinated, that you please continue to wear a mask when around people outside your household.
Thank you, Dr. Traxler. Samantha, we'll come back to you for follow-up questions or additional questions. MK, you've got a question for Dr. Traxler?
Hey, Dr. Traxler, you mentioned, I think in the beginning of the call, something about no appointment clinics. And I know in the beginning of this effort, we were trying to avoid, you know, the long lines, the people waiting out in the heat and that kind of thing. Has our thinking around that changed? And do you think that providers offering this no registration kind of clinic might be a way to get people in the door quickly? Could you just speak to that, please?
Sure. So I think that we still have to very much be aware of wanting to prevent long lines, both because of the concerns around just having people in a crowd together and potentially spreading the virus without realizing it, but also as we enter the summer and the heat in South Carolina. As we know, it is warmed up considerably this week and will continue to do so over the next few months. So, well, that is something that all providers, as they're scheduling clinics, need to be aware of, both for people with appointments and without. But, you know, additionally, as the other thing that we were trying to prevent, especially early on when vaccine was so scarce, was any wasted dose. And we certainly still don't want to see any wastage. But as vaccine amounts increase and potentially we have a little bit more flexibility in regards to that supply, then we will want to make it available to people who potentially could not have been vaccinated if they needed an appointment. So it's going to be a balancing act, and there are multiple factors to consider in it that we and partners will be looking at moving forward.
And so, Dr. Traxler, this is Christy. So Anne has dropped her comment. She's having trouble unmuting. She's dropped her question in the chat box. I'm not sure you're going to have the information, but her question is about a Clemson professor analyzing wastewater samples. He recently found 100% of COVID-19 cases in the Clemson area to be the UK variant. And her two questions are, is there any reason to doubt the data? And what is your take on the analysis?
So I would need more of the information on the methods and so forth that the Clemson professor was using to know, you know, whether there's any reason to doubt it or my take on it. You know, the first question of which would be how many specimens were taken, how many samples, how wide of an area were they taken from, even if it was within Clemson, you know, how many different locations, that sort of information. So I'm afraid I can't give very precise answers to those questions without knowing a lot more about the study. But certainly, you know, want to support and encourage those kinds of studies to be going on.
Thank you, Dr. Traxler. And so, Anne, we'll get back to you on that. Samantha, you had another question?
Hi, yes, and you may have hit it briefly when you were talking about variants, but in terms of that double mutant variant that they are currently watching out in Stanford and California, Is Dhec prepared to sequence mutations like that? And where are we in terms of the number of samples and test samples that we are sending off specifically for some of those mutations and variant sequencing?
Sure. And so both Dhec's public health laboratory and a lot of our partner laboratories, many of them, some national laboratories, continue to do sequencing, looking for one or multiple mutations. And we are continuing to increase the number of specimens that are getting analyzed, that are getting sequenced and analyzed on an ongoing basis. And we'll continue to do so as resources become more available and as we're able to continue to scale that practice. And so we continue to work with not only our lab, but partner labs who provide information then on their results of sequencing and analysis to us.
Okay, and we've got time for a few more questions. If any reporters have questions, can you please raise your little virtual hand so I can call on you when we have some order to our media briefing? Any questions from members of the media? Samantha, go ahead.
Just to follow up on that, Dr. Traxler, I wanted to wait my turn. Just to follow up on that, we have not seen specifically any of those cases here in South Carolina so far, correct?
I will have to get back to you on the answer for that, but I can tell you that we provide the most up-to-date information at that variant website that I mentioned earlier. And so I don't want to misspeak, having recently returned from leave, but I can assure you that we are keeping that up to date.
And you've got your hand raised. Do you have another question? You want to try to unmute or drop it in the chat? It must be the day for having technical issues. We appreciate the patience of our media members.
You can
anyone else have
it in the chat? I can see the chat.
Yes, exactly. Anyone else have questions for Dr. Traxler? No? Samantha, were you done with your questions? I think so. You just lowered your hand. Okay.
I'm trying to raise it again. If nobody else is going to ask a question, Christy, I'll ask another if that's okay.
Sure. We have time.
Sure, appreciate it. And Dr. Traxler, so appreciate your time, and we're certainly glad to have you back. In terms of the spring breakers, obviously, spring break is still going on right now. The potential for the fourth surge is still really an imminent possibility. And you talked a lot about the need for not only to see the plateau, obviously, but the drop as well. In terms of seeing a spike or a peak from all of that spring break travel, when might we expect that based on some of the experiences that we saw in both last summer and in the fall?
Sure. So we would expect after any event that we're or time period that we might be concerned about, we would want to particularly pay attention to that 4 or 5 days beginning to anywhere up to a couple of weeks, but primarily right around the 1 week point, plus or minus a few days on either direction, is when we would start watching. But as we've talked about many times during this pandemic, cases can occur up to 14 days, up to 2 full weeks after an exposure. But on average, it's closer to the 5-day point.
Okay, and Dr. Traxler, I know you're cutting out a little bit, but I think we got most of that. It's okay. Anne has dropped in a comment, question in the comments box. She says, do we have any comment on the CDC director on his comment?
And so you're cutting out on me, Christy, but I can see Anne's question. And also the CDC director now is also a she, Dr. Rochelle Walensky. And so I have not seen those comments to know specifically what she was saying, though it sounds like she's saying that the UK variant is the dominant strain in the US. And so we certainly are continuing to look at our data and monitor it in South Carolina. But I I would have to, again, look at the specifics. I don't know that it's necessarily the case for South Carolina, but we're continuing to monitor. And these variants, nationally as well as in South Carolina, are why we encourage everyone to get vaccinated as quickly as possible.
Yeah, that's a good reminder, Dr. Traxler. Anyone else have any questions? Or does Sam have another question she'd like to lob Dr. Traxler's way?
We're good. Thank you, Christy.
Okay.
You're welcome, Anne. She's adding to the chat box.
Yeah, thank you for. It's nice to have a redundant system when we need it. Certainly for you responses, getting those answers to those questions that Dr. Traxler didn't have information in front of her. We will work to get those responded to in a timely fashion. Would just like to thank everyone for your time and commitment to keeping everyone informed about South Carolina's COVID response and our vaccination rollout.